I've had a lot of like blood infections, and I don't know if you guys can see the back of my neck, but I have a giant scar from I have two rods. I have a rod here and a rod here, and they go down my back into my C-spine and my T-spine. I have pieces of my hip and my neck, and that's all from using dirty needles, reusing my needles, reusing like the cotton pieces. I don't know why I can't stop, you know what I mean? Like, I don't feel normal if I'm not on like some substance because I guess I've medicated myself for so long on that substance. I mean, not just like living in reality because of something that I've been through. Like, yeah, I've been through shit like as a kid, but I don't blame, that like on like my life right now, This is different from a needle exchange because a needle exchange just gives you supplies and then you leave.
The United States had over 100,000 overdoses last year. People talk about recovery, dead addicts don't recover. They're not here, right? 633 individuals, unique individuals using our sites in 6 weeks. 6 weeks. Over 6,000 utilizations of the site. 6,000 in 6 weeks. New York City had a number they were putting out there, hoping that we would be able to have 130 individual overdose interventions in the first year. We have 124 in the first few weeks, or less than 2 months. Behind those numbers are beautiful, kind-hearted people that just want to be here, that want to be loved and cared for, and we get to do that. And I ask you to join in on this movement. Harm reduction is real, harm reduction is a movement, harm reduction is love. I'm Sam Rivera, I'm the executive director of OnPoint NYC, and we're saving lives.
Hi guys, everybody good?
Yeah.
Still good? You're right where I left you.
Yeah.
Welcome to the New York Harm Reduction Educators in East Harlem. Come with me. We have our lower barrier services on the other side, and we circle through our garden into our drug user health hub here, where our participants can access low threshold medical care, nursing, and hygiene services. This entire building is about to be renovated because we're about to expand to 24-hour operations. We're going to have our own pharmacy installed up front. We'll have 4 treatment rooms here and a big group room that opens out onto our garden space. This is a really special program because it really is low barrier health care for people that are often excluded from the healthcare system, delivered in a loving and compassionate way by providers that we trust and that we know understand harm reduction for real.
We have an array of services attached to what we do, because when someone in that moment says it's time for me to try something else, we want to be able to connect them. Having wraparound services like case management and medical care, having folks have the opportunity to wash clothes and take a shower, feel good about themselves, get a decent meal, and then connect them to other services like buprenorphine, Suboxone, and potential housing services, etc. The Safe Consumption site is a place where people are welcome to come in and use their drugs in our presence. So we make sure they're safe, they're healthy, and we keep them alive. So if during that time someone happens to overdose, we respond and keep them alive with us. We have them spend as much time as they need to feel better about moving forward with their day. So they might leave the room when they're ready, sit out in our drop-in center, go upstairs to our holistics program and maybe receive acupuncture, or they can go outside to our garden. It's an opportunity for people to use a variety of drugs in a way that's safe, and at the same time build relationships. Oftentimes people use drugs in hiding, and that's why we lose so many people, which is why the United States had over 100,000 overdoses last year.
What happens when somebody ODs?
It basically depends on the overdose, how bad it is, because sometimes you can see it's really bad, sometimes it may not be as bad as others. So we have the tip back shots for the Narcan, which we try to use those sometimes instead of the full Narcan, the nasal, because the individual, once we hit them with the nasal, like they'll lose their whole high, even though that the Narcan just blocks the receptors, so all this stuff is still floating around in the brain, but they don't feel high. They go use again, and now when it all comes back, it's like too much. So with the tip back shots, you're able to just ease them out of the overdose, but they still maintain some sort of their highness, which is better in the long run.
You have an overdose downstairs, perhaps in our program, and imagine that this is the space you get to come to recover from your overdose, where you're receiving sound therapy and acupuncture and massage therapy with practitioners who understand what you're going through and want to make you feel comfortable and feel loved and respected and accepted for who you are.
There are people out there who think we're enabling drug use, and we're not. You know, it's not Nancy Reagan, just say no. It just doesn't work. It just doesn't work. It's interesting, people also ask us, why don't you just send them to treatment? With the assumption that all our participants haven't tried treatment. How about 100% of them? How about 100% of the people who have come into our program to use our safe consumption site have tried detox and treatment? They're going to use, how do we keep them alive, right? They're going to use, how do we engage them in conversation while they are?
I've been in treatment, like I said, you know, first time I went to treatment when I was 18. So I'm over 10 times alone this last year, 3 times last year, and then 4 years ago I was there like 2 times. I went to detox rehab, then I went to a 6 to 9 month program. I went to that program and there was more drugs in there than there was in the street, and that kind of like shocked me. The big thing is just say no, you know? It's hard to just say no when like, you know, like this has been in my life every day.
It's a shame that people just jump to judgment and say, well, you just enable it. When we know factually what we're doing is creating a dialogue for our people to get well. Harm reduction is really the medicine for people. Communities say they don't want drugs in their street. They don't want someone using in the street in front of their children. Or they don't want drug paraphernalia in front of schools or in the street. We agree. Bring those folks into our facility and use here. After someone uses, none of their paraphernalia leaves the building. We collect it all. So we're creating a space around that not only keeps our participants safe, but keeps the community safe.
Like it's 100% the OPC, and it's like this, and then it goes whoosh. So much so that like Julian and the commission from the Parks Department is like, what's happening?
We need to get this to
it's crazy.
to Alex and all. Oh my God, this
crazy.
is like, look.
But you know that
what are we gonna do with that data?
But
Yeah. In New York City, I don't think it's unique to New York, but a lot of our folks use parks. That's where they hide out. It's where they could really get some privacy. What we just heard, which is literally right in the moment, they used to collect thousands of syringes monthly, and there was a huge drop. And the Parks Department reached out to us and said, "What's going on? We're shocked. Do you have more people in the parks?" Because we have a team that goes into the parks. So they thought for sure we increased that team. They're not seeing the syringes in the way they were before. And so Kaylin pulled the data and can see when the number changed, and it literally changed when we opened the OPC. So all of those syringes, what we found was we have 13,000 syringes. So we have them. And it's just like, wow. Yeah. Yeah, it's just fucking amazing that we're making that impact, you know. And it's a big deal to make sure that not only that we provide services to our people, but also impact the community. You know, we're not against the community. We agree with the community. So to know that we collected 13,000 syringes that could have been in a park, and we have them, and we'll dispose of them safely, is beautiful.
I've been homeless more times than I can count the last year, and it sucks. I'm a big believer in harm reduction because I'd say, me personally, if I wasn't, I'd be using the street, I'd be using dirty needles. You know, I pick needles up off the ground to use them and stuff like that, and none of that's healthy, safe, and that's, you know, how it's led me to be in the hospital multiple times. You know, like the last time I was in the hospital, I was there for 80 days. I had a blood and staph infection, and then I had MRSA, so I almost died.
I've really seen what it's like to not be able to get the help that you need and not be able to be who you really are, and the way that it hurts and divides families and creates so much pain for people that lasts for a really long time. And harm reduction is a remedy to so much of that.
It's a blessing to talk to people about what's really happening. What are they self-medicating? What is the pain they're dealing with? Where does this come from? What happened in your life or mental illness? What is it that's driving you to self-medicate? All of us, many of us in this world, we self-medicate in different ways. Some people self-medicate through food, gambling, through a number of things, shopping. For our people, they're self-medicating pain. A lot of deep, deep pain. We know that most of the people we work with have been physically abused, have been sexually abused. There are elements of pain that people just oftentimes can't recognize. I was talking to a few of our participants and they were like, well, I can't remember anything major in my life. And then as we're talking, they go, it's not like my mom, who used to get abused in front of me. And I'm like, there it is. There it is. At the core of your drug use is this trauma you're self-medicating. Harm reduction has and continues to save lives in the most remarkable ways. Dead users don't go to treatment, and dead users don't recover, and dead users don't get well or be with their families and spend holidays and become what people might want them to be. But what do they want to be, right? They want to be alive first, so we got to keep them alive. Harm reduction keeps them alive. Harm reduction creates a safe, loving space. When people enter our program and when people enter our safe consumption site, things shift in a way that's mind-blowing, because oftentimes when people use, they hide and use. Here, people use in our presence, we start having conversations with them. They want to talk about their life. They want to talk about their family. And it's just a shift in a way that's needed everywhere. Allow us to exist. Allow us to open up in other places. We are on the phone with multiple cities every night, every day. Folks everywhere want this opportunity. Harm reduction works. Harm reduction is important. Harm reduction keeps people alive. We were the ones who were able to prove it works here in the United States. Thank you for that. Please support folks in your neighborhood. If you hear the term harm reduction, I hope you understand it better. I hope you know it's a loving health intervention that keeps people alive. Working with people who too many others see them as disposable. People who have been forgotten for way too long. To watch beautiful people feel grateful about just being treated as human. What we're doing as far as operating the first two safe consumption sites in the country of the United States. It's really important that we all celebrate this. We find out how do we open the second, the third, and the 21st, and more and more and more.